you're gonna get thousands and thousands of dollars less for the same exact patient, even after being approved for an inpatient stay. Picture this. You submit an inpatient claim to Aetna and it gets approved. There's no prior auth, there's no denial, you didn't have to go through a peer-to-peer review, and your billing system shows that this claim was paid in full. This is fantastic news, right? Well, the reality is that's actually not always going to be the case. Starting on November 15th, Aetna is going to start automatically approving inpatient Medicare Advantage admissions that span at least one midnight. This sounds like a great change, but the reality is if your case doesn't meet the Milliman Care Guidelines, it's still going to be approved, but they're going to pay you at a lower observation level rate. This means that you're going to get thousands and thousands of dollars less for the same exact patient, even after being approved for an inpatient stay. And the worst part of this is that there's no formal denial for you to appeal. There's not going to be a notification. It's just going to show up as a quiet underpayment on your 835 as a contractual adjustment. And this isn't just about a single payer. Other Medicare Advantage plans are going to start following Aetna's lead, and all of the wins we saw from the 2 midnight rule will completely disappear. When CMS mandated that Medicare Advantage plans begin to follow this 2 midnight rule, inpatient admissions started to rise 3.9% year over year. Aetna just figured out how they're going to work around it. And if you want to fight this, this is what you need to start doing immediately. First is you need to start tracking your expected versus actual reimbursements at the claim level. 2, you need to make sure your team understands the MCG criteria and they're able to clearly document inpatient level care. And finally, it's important all of us start to push back on this before it becomes standard practice across all Medicare Advantage plans.